Menopur 150 units mixing and injection. You will need 2 vials of Menopur and 1 vial of saline. Wash your hands, working on a clean surface. The injection mat is really handy. Remove the caps off the top of the medication and saline vials. Using the Q-cap. Open up your supplies, syringe, needle, and Q-cap. Pick up the Q-cap by the rim. Don't touch the sharp point. Twist, don't push, the Q-cap into the end of the syringe. Tighten it enough so the Q-cap stays on, but not so tight that you can't remove it when finished. Menopur 150 mixing. Pull up 1 milliliter of air into the syringe. Holding the vial of saline on a level surface, insert the syringe with Q-cap into the saline vial. Inject the air into the vial. Keep your thumb on the plunger. Invert the vial. Remove your thumb from the plunger and allow the syringe to fill with 1 milliliter of saline. You can pull down on the plunger to get 1 milliliter of saline into the syringe. Remove the saline vial from the syringe by holding it horizontally and snap the vial off. Be careful not to press down on the plunger or you will lose some saline. Holding the medication vial firmly on a flat surface, insert the saline syringe with Q-cap into the vial. Inject the saline into the vial. Keep your thumb on the plunger. Gently swirl. Don't shake. Vial to mix the powder into the saline. Once the powder is completely dissolved in the saline, invert the vial and withdraw 1 cc of dissolved medication from the vial. Inject the solution into the second vial of Menopur powder. Keeping thumb on plunger, gently swirl the vial to mix the medication. Invert the vial and withdraw 1 milliliter of dissolved medication from the vial. Tap gently to remove air bubbles. Remove the Q-cap from the syringe and attach the needle with a gentle twist. Menopur 150 injection. Swab injection site with an alcohol swab. Pinch the skin. Inject at a 90-degree angle. Dispose Q-cap and needle in Sharp's container, and the vials into recycling. Injection tips. Inject anywhere on your belly except for the 1-inch area around your belly button. Use a different injection spot each time. You may get a small bruise or a mark that looks like a mosquito bite. That's all normal. Olive Fertility Center. Your nurse will review this information with you at your orientation session. Once you start injections, please call your team nurses or the general nurse line between 7:30 a.m. to 3 p.m. if you have questions.